I went to see the building on Duke Street, and on the side of the brick building, the wall, was Crips, a big gang. So I had the key and went in and looked. I thought, oh yeah, we can really do something. Came out, and there sitting on the stoop was a gang member. And I said to him, tomorrow I'm going to be here at this same time, and I need to see the big man. I need to see the big man. So you tell me. Okay. I didn't know who the hell that was. But for sure, up he comes.
He probably didn't know what you meant.
No, he didn't. Pants were hanging down, the hat's back, the whole shebang. I said, listen, I'm a nurse. That always helps, And we're going to put dying AIDS patients here. And I need you and your boys to protect us. There was never a word again. I think we had a large Hispanic population in York, and it was a lot of drug infection. In York, actually, weren't we about third in the state for HIV and AIDS?
Yes, probably other places maybe had more, but they weren't doing as much testing as we were.
So we found that the need actually was there, and I had just lost a job at a hospital in Baltimore when they closed, and was thinking, gee, where am I going to put my skills? And I'm up in the woods under a pine tree, and just sort of contemplating what I'm going to do, and I'm digging in the dirt, and up comes this plastic letter A from a child's refrigerator magnet, and I get this, it's AIDS. You just can't open a hospice and have Aunt Nellie's bedroom, filled with people without any, not licensure, but a real coverage to make sure the quality of care is there. And I needed a medical director. And Dr. Hawk was heavy into, was it testing mostly then?
Mostly testing at that time, yes. And education.
Oh, yeah.
And a lot of public education, a lot of education of those who were positive that we had detected, and even those that weren't had risk behaviors that we had to try to convince them that they need to correct those risk behaviors.
Right. And so we, I think Bernie was doing a lot of work in the community, and he said, there's an empty house up on Duke Street that the city owned. And so we went to the mayor and said, could we have it? And he said, I'll give it to you for $1 if you pay property tax every year. I said, sure, we can do that. And then the whole community just came forth. People wouldn't say no. We'd ask everybody to give and to come help, and Bradley Art Academy took us for their School of Design, and so they were making beautiful rooms, and we'd consult with them. This is the wallpaper we want, Joy. And I said, no, now you see that wallpaper looks like a peacock tail, and it has sort of eyes, and that would be very frightening to patients if they had metastasis to the brain, So it was a lot of attention to detail. And then we got our 3 rooms ready, which meant we didn't have to go under Medicare or get a personal care license. 3 rooms or less. And the need was there, and the referrals started coming, and we got nurses, and this thing just, it was divine. The drive was there, and the fire in the belly.
AIDS epidemic, there was some fear within the community. There was prejudice. There was people who feared for their confidentiality if they were tested positive or had AIDS. So there were those negative feelings around. And of course you always had to try to do your best to support and provide the hope that no negative consequences would come from people knowing about their problem, but we also had the issue of also counseling them about where this was going as far as their illness goes. And at that time we had very little to treat people with, so we pretty much waited around until they got to the point where they were dying. And it was a very sad kind of situation that we weren't, as health professionals, able to offer them more. But at least we were able to offer them comfort when they were dying at our hospice.
And dignity. I think that was a big part, because a lot of the patients were sort of the waifs of society, and then once they contracted AIDS, you were really lepers. And by 90, though, we knew how it was transmitted. Mm-hmm. And I think that helped, because nurses were fully willing to come and work and hands-on care, and none of us feared for transmission at all. So. Probably my favorite was Jaime. And this was a migrant worker in Adams County. So he was with those big orchards up there, apple and grape orchards and all. And we got a call, and I went up to see him, and it was in just austere conditions where these men were living, just this cinder block building, and open urinals and just cots. And he was very sick and only spoke Spanish. And so someone up there had gotten in touch with, I think, the health group. So we had that referral. I brought him in my car back to the hospice. And he was very uncertain what was going on. And as a Hispanic male, very embarrassed. We don't know how he contracted, but he was embarrassed about that. And we had a Capuchin priest that we just loved, Dr. Carter. And so it was Father Carter and Dr. Hawk and myself at Jaime's bed. And in Spanish, he asked Father Carter what was going to happen to him. And I think Father Carter looked at Dr. Hawk, and Dr. Hawk said that and I got the word mort out of the Spanish. And then Dr. Hawk, it was just so moving. Oh, my heart broke for this young man. And so Dr. Hawk explained to Father Carter that he was going to die here with us, but that we loved him and that it would be good. And you could just see Jaime just settle in a little bit. And then Father Carter's church was just Hispanic, and they came that following Sunday with their guitars and they sang all this wonderful music to Jaime. He died, and we had him cremated. We tried to find his family, I think in Puerto Rico, and we got someone there through social services, but they were afraid they were going to be charged for the funeral. And we said no, and we had him, the funeral director did the cremation free, and I had his ashes in a wonderful false graft urn on the mantle in my office. And when the hospice closed, I brought it here, and I spread his ashes in the vineyard up over the hill.
Some of the situations I just remember as real learning experiences. You taught me a lot about death and dying. I'm very thankful for that. But one was the patient we had in the room, and you said, Dr. Hawk, I have something to show you this morning, but you finish up what you have to do, and then let's go see our patient. And it was the young man who was dying, and he was in bed, just lying back, very weak, very tired. And she said to the patient, are those visitors that come to visit with you here this morning? And I thought to myself, what is Joy doing to me? What's going on here? And as weak as this individual was, he got up very gently on his elbows, and he turned himself to the left. I can still remember him doing this. And he looked over in the corner of the room, and he lied back and he said, no, they're not here right now. And Joy talks a lot about companions and travelers and followers and things. And it was the first time for me as a medical person where I said to myself, oh my God, there really is things that we don't understand about the dying process.
Yeah.
It was an eye-opener for me. And now I get to the point where people tell me that they have conversations with some of their loved ones who've passed away.
Mm-hmm. Yeah.
I'm at the point now where
Sure.
they were very well might have.
Oh, sure. That was Bernie. And he was an artist and called me up to his room the day before and said, mm-hmm. Do you see them, Joy? Can you see them? And I said, I can't see them. Tell me. And he said, they're huge. And as an artist, he knew these colors. He said, I have never seen these colors before. Can't you see them? And I said, Bernie, I can't. They're here for you. And you can go with them. It's very safe, and, mm-hmm. and they love you. But they weren't. I wanted Dave to witness that they were there, but no, they weren't there.
So there have been a lot of memories and things with our patients, and it was an invaluable experience, I think, that we offered to those people at that time.